Well, it looks like, Congressman Shadegg, that the whole thing's been GPSed out by the Democrats. It looks like there's going to be a meeting tomorrow, followed by some sort of recognition that you didn't get together as two parties, and a decision by the Democrats to go it alone and go through the up or down vote in the U.S. Senate with a majority vote being sufficient. Is that the way you see it, you Republicans?
Well, let's hope not. I hope that what we do tomorrow is make real progress on areas where we can find agreement. I think there are areas where we can find agreement. I think there are areas such as pre-existing conditions. There are areas such as increasing competition and bringing down costs where we can find agreement. And hopefully that's what this meeting will be about. That's what the American people want. I hope we can get away from the politics of saying, well, this party doesn't have any ideas or that party wants it their way or no way at all. Because what the American people want us to do is get this problem solved and deal with the fact that healthcare costs are going up faster than all other costs in our economy. And I think that's what tomorrow ought to be about. Okay.
My question before I get to Congressman Van Hollen is, why should the Democrats modify their bill according to your specifications unless you people are willing to vote for it if they do that?
Well, I think we should really be beginning with any bill. I quite frankly think it's pretty clear the American people don't want the House or Senate bills. 56% of them say they don't. But there are things on which we can agree, and there are things on which Republicans ought to be willing to agree with Democrats on. Republicans are certainly willing to agree that we should cover everyone with a pre-existing condition and nobody should be left out. I think Republicans are willing to embrace so-called universal coverage. I've introduced legislation virtually every year I've been here to cover every single American. So there are things that we can't agree on. Neither side should start, I don't think, with pre-existing conditions.
Okay, pre-existing conditions. I know what you mean. I know what you mean in terms of the debate. Let me go to Congressman Van Hollen on the question. It seems to me that if you listen to Pfeiffer down at the White House, the spokesman for the president, it's pretty clear that they see themselves probably heading towards an up or down vote in the Senate based on majority rule, not on some 60-vote deal. What do you think they're headed towards down at the White House?
Well, first, Chris, look, I agree with John. We want to see how this goes tomorrow. The president has invited people down to the White House in good faith to have what our Republican colleagues, our Democratic colleagues, and the American people have been asking for, which is a big public discussion on health care. I think it's unfortunate that Mike Pence called it a setup. I mean, this is going to be in the full light of day. People are going to be watching. I think it's important that we find out exactly what people want to accomplish and what their different ideas for getting there are. And the president has put a proposal on the table. It will be interesting to see what our colleagues on the other side have to say, for example, of what John just raised on making sure we prohibit insurance companies from denying people care based on pre-existing conditions. That's in the president's plan. That's not in the Republican plan.
But isn't it a setup in the sense that your party and the president are starting with a big plan, which the president released this Monday, which is a conclusive, almost $1 trillion plan to provide health care for the 30 million plus who aren't covered. And that's what you want to start with as your model and then make modifications in it. Congressman Shadegg, and I believe the other Republicans' view is start from scratch and put together a compromise proposal. Isn't that the big difference, Congressman Van Hollen, in approaching this debate tomorrow?
Well, no, as John said, I mean, they have put plans on the table, and the question is whether they measure up to the task that the American people know we face when it comes to rising health care costs, trying to bring down the deficit, and trying to bring down the costs. Because, no, it is true that they have put some things on the table, but the Congressional Budget Office has looked at their plan and said, you know, after 20 years, there are only 3 million more Americans covered. But Chris, the point is that the president says, here's how we're going to get there. And he's invited our Republican colleagues to say, do we agree on the goals? And if so, what's your proposal?
Congressman Shadegg, it does seem to me there's a difference. You want to go in there with a Vegematic like Ed McMahon and start all over again, chop it up, and decide what pieces you like on both sides of the aisle. The president says, here's basically what I believe in. I'm willing to accept some modifications in it. It just seems there's a total difference in approach at sitting at that table at 10 o'clock tomorrow morning.
Let's talk about the difference in approach. Let's talk about one of the biggest issues confronting the American people on health care, and that's pre-existing conditions. In point of fact, the Congress in 2006 passed legislation to address the problem of pre-existing conditions. It passed the House by a voice vote. It passed the United States Senate by a UC. I happen to have written the bill. It's a bill that said every single state should create a high-risk pool to cover people with pre-existing conditions. I have an older sister who's a breast cancer survivor, and it said, look, you create a high-risk pool, the federal government will help you create that pool and will help fund that pool, and with that, we can then cover every single American with a pre-existing condition. If we already passed that once, and the only default was we didn't force the states to do it, why don't we do that now, require the states to do it, and if any state doesn't do it, create a federal high-risk pool and solve that one problem? I don't see how that is really good progress on this issue.
Congressman Howard, respond to that proposal.
This is a great example. The way first of all, the president has included in the bill, if you look in the thing he put on the website, there is a provision to create high-risk pools, exactly what John said. Many states have already created those. We should continue to create incentives. But the fact of the matter is the reason the Congressional Budget Office looked at their plan and said after 20 years you're only going to get 3 million more Americans on it is because even with those high-risk pools, two things happen. Number one, premiums keep going up. You can have a high-risk pool, but if the premiums are through the roof, you can't afford it. And number two, under their plan, an insurance company can still tell you no. An insurance company can still tell you no.
Gentlemen, I hope we have this debate tomorrow. We're going to have it tomorrow from 10 o'clock in the morning to 4 in the afternoon at Blair House. Then we'll be on tomorrow night, Keith and I, to talk about it. But let me ask you this about this question.
The premiums in the bill I passed are already capped, Chris.
Okay. Yeah. Congressman Shadegg, are you with the other Republicans who are putting out the word in negotiations with the White House that the President of the United States should not have a lectern tomorrow? Are you with that effort? Yeah, he should sit at the table at the same level as you guys. Is that important to you?
I think, quite frankly, this whole discussion should have been at the table with the same level. I think in part the reason the president is doing this is because he left the writing of this bill to the Congress. I think he may have thought it was going to be a bipartisan process, but down at this end of Pennsylvania Avenue, it was not a bipartisan process. We were not allowed, Republicans were not allowed in the room in the Commerce Committee to write any of this bill. When it went through markup in the committee, the Democrats accepted a number of amendments, and then Mrs. Pelosi ripped those amendments out of the bill before it went to the Rules Committee. If this is going to be a discussion, it would be better if he sat at the table, but he's the President of the United States.
Okay. I'm not going to dictate to him. Here's what I think Republicans are afraid of, and then I'll let Congressman Van Hollen speak. This was about optics, I think, the question whether the President should look elevated or not in television tomorrow. Here's a scene from the White House summit held 1 year ago, an exchange between President Obama and the man he beat for President, Senator McCain. I think if you watch it, you'll understand why the Republicans are sensitive about this kind of higher plane for the president.
I'm going to start with John McCain because and you know he and I had some good debates about these issues, but and I mean what I say here, I think John has also been extraordinarily consistent and sincere about these issues, and I want to see if you, John, you've got some thoughts.
Well, Mr. President, thank you for doing this. I think it's very important.
Your helicopter is now going to cost as much as Air Force One. I don't think that there's any more graphic demonstration of how good ideas have cost taxpayers an enormous amount of money.
The helicopter I have now seems perfectly adequate to me. Of course, I've never had a helicopter before. So.
You know, that format Congressman Van Hollen makes the President of the United States look like the principal of the school and John McCain, who lost a pretty good election to him, like a third grader. Do you think it's a fair format to have the President standing up there like God, and or principal at least, and the Republicans sitting there like pupils?
Look, I think it's a good exchange for people to have. You had the president appear at the Baltimore at the conference. Well, look, I don't know if it's fair or not, and I don't even know what format
why don't you know? It's a reasonable question. Is it fair?
No, I don't. I think was that a fair exchange? Of course, and the Republicans had the opportunity to focus on the issues they cared about. He said to our colleagues, you tell me what your top priority is. And so, you know, the ball was in their court. I mean, just because the president has a good response to it doesn't mean it's unfair. Let me just say on these hearings, we had a lot of hearings. The American people know we had hearings in the House, hearings in the Senate. We had markups in the House, 3 committees in the House, 2 committees in the Senate. We had an extended period over the summer when you had 3 Republicans and 3 Democrats in the Senate. Senator Grassley changed his mind. He took the position for many, many months that in order to make health insurance reform work, you need everybody in the pool. And then he totally changed on that.
I thought we were talking about the House process.
We're talking about the whole process. That's why we're having the process at the White House. The House process, you know, we had hearings, we had markups. Senate had a
in the
process.
markup, you tell me, Chris, how often it happens that you go to a market, the Democrats agree to amendments in the markup, and the Speaker then pulls those amendments out between when it leaves committee at the markup and when it gets to the Rules Committee and before it comes to the floor.
John,
how fair is
look,
that?
We had a number of amendments, as you know, that were adopted during that amendment process in the House. Amendments were adopted in the Republican side.
We didn't have a single amendment on the floor. And in committee, she pulled them back out.
We have to do this tomorrow, Congressman.
So here's the opportunity to go down to the White House and talk about all the things you say you didn't get that you want to get in.
And I think we should.
Tomorrow morning, the opportunity
are.
arrives. Okay, tomorrow on national television, MSNBC, you'll be able to see that debate. Of course, I think one way to save time tomorrow is everybody, including the president, don't give an opening statement. And that takes up the whole morning. I've been through those babies. Anyway, thank you, Congressman Chris Van Hollen, who happens to be my congressman, my wife and I congressman, and my kids congressman. And he's a good one. And U.S. Congressman John Shadegg, who I understand is a real intellectual conservative, and I've always respected that position. I mean it. And a reminder, tomorrow night